to the well-being and continuity of society. My administration resonated with the rallying call that no mother should lose her life while bringing forth another person. In this regard, I would like to express my sincere condolences to one mother who we lost yesterday. Our heart goes to the family and also to the resident of Nairagie Angare. In this regard, we have established robust maternal and child health care services and programs and conducted awareness campaign up to the grassroots level with the help of our community health volunteers. However, a lot still remains to be done. I believe that with the support of the Afya Uzazi Salama program, we will be able to accelerate the improvement of maternal, neonatal, child, and adolescents' health outcomes, as well as tackle non-communicable diseases in Narok East Sub-County and Narok County at large. My administration, on its part, has made commendable strides in addressing the many challenges that continually affecting the provision of healthcare in the county. As we all know, healthcare is default function. Provision of quality healthcare services is therefore one of the key mandates of my administration. Further, to reduce the overall cost of healthcare, we have increased budgetary allocation for medicine and medical supply from Kenya shilling 40 million to 90 million, and streamline the distribution channel to ensure that these supplies reach all the health facilities across the county. This intervention has enabled patients to get their prescription free of charge at the health facility, effectively cutting the cost of buying medicine from private pharmacies. My administration is also working around the clock to ensure that newly constructed Narok Referral Hospital and Narok Kenya Medical Training College are operational. I also take this opportunity to welcome the chairman of Safaricom Foundation to visit us and see what we have done at the referral hospital. It will be one of its unique referral hospital in Kenya. We will soon make sure that it's operationalized. It's 90% done. We are steadily equipping this facility with the support of national government and various partners, and I believe that we will commission them soon for operation. Ladies and gentlemen, my administration is keen on improving and expanding the infrastructure of healthcare facilities across the county. In this regard, we have enlisted over 70 healthcare infrastructure projects in our 2022-2023 County Integrated Development Plan, CIDP. I launched the construction of this project, including 24 dispensary, 24 maternity wings, and 22 staff quarters. And I'm glad that most of them are complete and ready for operation. So this issue of mothers still giving birth at home will be a thing of the past once we make these facilities operational. In addition to the above, my government is committed to bringing healthcare services closer to the people. The construction of these facilities is just the first step in achieving this objective. Collaboration with healthcare partners through programs like the Afya Uzazi Salama program are the next step. As I end my brief remarks, allow me to say that in the end, the true measure of society greatness lies not only in its advancement in technology or wealth, but in its commitment to ensuring that every member, regardless of their circumstances, can access the basic human rights to health and well-being. Thank you very much. Allow me also, 1,000 people have already are actually online to be tested, to be screened, and that shows that we really needed more days. Chairman and the group from Safaricom and Amref, my request is that let's do it one more, because I'm surprised that over 3,000 have come in and they are still streaming. I'm told that a number of people are still coming. Some of them have not heard about this camp, but when they heard from phone calls by relatives that the doctors are doing a good job, I don't know whether this day is enough. And because I know you, Chairman, and you know we live in Kenya, and this is African nation, I would ask you that if we can give the doctors to continue for the next one day. Otherwise, I don't think... Ama namna gani? Si chairman yuko hapa na governor yuko hapa, wanatoa tu amri na hiyo maneno inaisha. Because I don't want us to really lock out anybody, because these people are very needy and they have seen that there are very good doctors there who are helping them. Allow me, on a different issue, to congratulate His Excellency the President for hosting a successful African climate change. All of us are now alive to the fact that global warming is with us. For the last 3 or 4 years here in the county, we have suffered because, again, of prolonged drought. And that is why I want to request our people that we have a very good plan. Now that El Nino is coming, that we are going to plant so many trees. And we have a program, the Department of Environment is working with our schools so that we can begin with schools. All the primary and secondary schools in our county, we are going to fence, because the problem that we have is our livestock, wild, and the animals that we have in our homes, and therefore there is a need for us to fence those schools so that when our children grow trees, then they can be watering those trees when they come to school and when they are leaving school. So we want to congratulate our Excellency the President for a well done job. This is something that all the African countries, the 22 heads of state, have confirmed that this is the way to go. And we must start addressing our own issues instead of just looking at our bigger brothers from Western countries. Also, us as a county government, we have allocated 3% of our budget to environment, so that as the national government rolls out their program, we here in the county government, we will also be helping. Wananchi wetu wanarejea Enakare, kuna mambo kadhaa ambayo ndogo kwa hospitali. Kuna moga ambayo ilikuwa imalizwe bado haijakamilika, lakini tumeweka pesa ya hii mwaka 2023-2024, na pia nimeona laundry bado haijakamilika, ijapokuwa all the facilities and all the equipments are here. I'm sending my team, the GDU team, to come and see when the program, when some of the laundry and the kitchen is not yet done. I want to assure you, kutoka hii wiki ambayo inakuja wanataka kuassess, tutaambia huyo mama ambaye alikuwa anafanya aje, kama ni pesa hakuwa amelipwa atalipwa, arudi kazi aendelee na hiyo kazi. Jambo la pili ni kwamba nimesikia hatuna stima hapa. Ile stima tuko naye haiwezi inua ile machines ambayo tuko naye. Tayari tumeongea na Njoroge ambayo ndio manager ya Kenya Power Lightning, na amenihakikisha ya kwamba alikuwa anahitaji 90,000. Ametumiwa, anakuja kesho hapa kuweka hiyo three phase so that tuweze kusaidiana. Na pia labda tutakuja kuweka either generator Daktari Kio, ama ni generator ama ni solar. Unajua siku hizi tunataka kutoka kwa hii mambo ya fuel, tunataka kuweka solar. Sijui hapa na Rajangare najua kuna kuanga na gisa sana kwa sababu ni pale ambapo inanyesha. So labda what we need ni kwamba tulete tu generator for the time being, alafu tuone vile hizo three phase. Na siku hizi stima ya Kenya Power sio mbaya sana, ni juzi tu ndio imeleta shida, lakini tunaona inaendelea vizuri. So hiyo I can assure you daktari, hiyo Njoroge ameniambia kesho na ameshatumiwa hiyo pesa, alafu wajaendelee. Jambo la tatu ni mambo ya maji. Poleni watu ya hapa hiyo hospitali, tumekuwa na shida ya maji, na ni kwa sababu hapa Narok East yote somehow I don't know, kwa sababu ukitoka hapa kwenda Suswa tumejaribu mara mingi kupata maji kupitia ile ya drilling, lakini unapo drill ukifika tu 200 meters, this is 200 meters kama nini, 200 meters moto inatoka. So hii watu tunapea kazi wanasema hizo chuma wanaweka inaenda inakuwa moto, inatoka kama ikiwa kama red. So wameogopa sana na wametutorokea kabisa. Sasa tuko na shida kubwa sana hii Suswa ward, lakini tunashukuru ile ambayo nimeleta Suswa town, na hii nyingine nashukuru sana Ken Aramat tumeshikania na wewe, na nimeona leo matangazo imewekwa kwa gazeti ili ile maji nyingine ambayo inatoka Naivasha ije iende mpaka duka moja. Nafikiri hiyo sasa iko kamili, na nashukuru kwa sababu watapewa wale ambao wataangalia. Lakini tuko na hii maji ambayo ilikuwa imekuwa drill na imekuwa successful. Hii ambayo ilitolewa na kampani gani? Vami. I think what we need to do ni kwamba kwa ile pesa kidogo yetu ya Danida CEO na CC hii kupipe tu hii maji kutoka hapa, amtaki governor, ile pesa kidogo nyinyi mko naye, pipe hiyo maji kuja hapa kwa ndani ya hospitali. Na tutaki tena kusikia mambo ya maji. Siku hizi tumewapea pesa mingi, hata nyinyi mfanye innovative, mfanye innovation kidogo. Jambo la pili ni kwamba the youth, ama kabla sijaenda youth,